Impact of the Affordable Care Act on Healthcare Access, Cost, and Quality. A presentation assembled by Frita Boyd, Timothy Hearn, Alicia Snellings, and Rossell Willis.
So for our Impact of the Affordable Care Act executive summary, we identify the goals of the Affordable Care Act to include establishes the legal framework for U.S. citizens' access to health insurance from birth to retirement, a reduction in the number of the uninsured by 31 million people in the United States. The Affordable Care Act assumes that shared responsibility is assigned to governments, individuals, and employers with a goal of improvement in fairness, quality, and affordability of all health care. Improvement in healthcare value and efficiency is the second goal, and then improvement in primary care and public health.
The impact of the Affordable Care Act access mechanism. The Affordable Care Act expanded coverage through two key mechanisms. One being Medicaid expansion for those with the lowest incomes, and the other being federal subsidies to purchase private coverage in new health insurance marketplaces for those with moderate incomes. Access also includes the following. Young adults can remain on a parent's plan until their 26th birthday through private employers. Individuals get comprehensive insurance regardless of health status, and it requires that individual obtain insurance or pay a penalty. The Affordable Care Act substantially improved access to care among non-elderly adults. Relative to 2013, insurance coverage in Medicaid expansion states increased by 6.5 percentage points in 2014, 9.7 percentage points in 2015, and 11.8 points in 2016. The American Care Act also increased the likelihood of having a primary care doctor, with the effects growing over time. It also increased the probability of reporting excellent health and reduced days in poor mental health. According to the National Center of Health Statistics reported 2019, the number of uninsured has decreased from 15.4% in 1997 to 9.4% in 2008.
For the cost component of the Affordable Care Act's impact, we first discuss it at the federal government level. The initial authorization for the Affordable Care Act was for $100 billion in mandatory federal funding and another $100 billion in discretionary federal funding for fiscal years 2010 through 2019. That equated to $63.50 per capita per annum in costs. The $100 billion in mandatory funding and the other $100 billion in discretionary funding were targeted for the direct financing of new insurance programs, as well as an extension of existing grant programs, and to supply new tax credit options and rebates to consumers, nonprofit agencies, and state and local governments to incentivize implementation of the Affordable Care Act. The highest amount utilized of that funding source was in year one was to California, which utilized $1.143 billion. The lowest amount in year one in 2010 was to North Dakota, only $22 million. On a per capita basis, the highest amount was utilized in Rhode Island at $108.90 per capita, while the lowest amount utilized in year one was in Florida for $15.14 per capita. Budgeted sources and purposes of funding for the Affordable Care Act's costs included 47% from employers and businesses, 21.8% towards private insurance and the exchanges, 8.2% for Medicare and Medicaid, 8.1% for health centers, and then a combined 14% for prevention and public health, maternal and pregnancy funding, workforce and training, and healthcare facilities and clinics. At the state level, in terms of the impact of the Affordable Care Act on cost, state exchanges and regulators are expected to eliminate pre-existing conditions as a basis for not only pricing, but also for waiting periods in excess of 90 days for treatment. Also, from a cost standpoint at the state level, beneficiaries' children were allowed to continue to be enrolled on a parent's insurance plan to age 26, regardless of their status as an active student. The states were also expected to expand Medicaid enrollment by allowing inclusion of the poor and working poor, with a cap of 138% of the federal poverty standard. 138% equals approximately $16,000 for a single person in income. The Affordable Care Act also banned lifetime financial caps for consumers' health treatment costs. In terms of cost controls, moratoriums were placed on the expansion of physician-owned hospitals as a part of the Affordable Care Act. Also, there was a prohibition on any new construction of physician-owned hospitals. Hospitals were incentivized to significantly reduce hospital-acquired conditions and patient readmissions. Movement away from treatment as volume-based care and movement towards value-based or performance-based care were also conditions for hospitals in the Affordable Care Act. And then the creation of Affordable Care Organizations, or ACOs, which shift financial risk within Medicare from CMS to the healthcare provider, was an additional condition.
To better understand how the Affordable Care Act has affected Americans, let's take a look at how the Obamacare subsidies work.
Here's a question we get all the time. Can you explain how these Obamacare subsidies work? The answer is complicated, but here are the basics. Under the Affordable Care Act, you may qualify for a subsidy if 1. You live in the U.S. 2. You're a U.S. citizen, a U.S. national, or you're otherwise lawfully present in the U.S. 3. And you're not currently incarcerated. 4. And you don't have access to affordable health insurance from an employer, a union, or a federal program like Medicare. But there's another important rule. In order to qualify for Obamacare subsidies, your taxable household income needs to fall between 133% and 400% of the federal poverty level. If you meet all of these criteria, you're likely to qualify for a subsidy that lowers your monthly health insurance premiums. How much will your subsidy be? That's where things get really complicated. Depending on where your income falls in the eligible range, government subsidies will limit what you're required to contribute to your monthly premiums to a set percentage of your income. On the low end, if your income is only about 133% of the federal poverty level, subsidies will come in and limit your cost for a benchmark plan to about 3% of your taxable income. Confused? Here's an example. Let's say you wanted to buy the second least expensive silver plan in your area, and your monthly taxable income is 133% of the federal poverty level. You would be earning a taxable income of about $1,316 per month in 2016. At that income level, you'd be expected to contribute no more than 3% of your income, about $40 per month, to buy that second least expensive silver level plan. The government subsidy pays the rest of your monthly premium. So if the second least expensive silver plan costs $400, then you pay $40 for that plan, and your subsidy amount is $360. But what if you decide to buy a gold plan instead, and the cost of that gold plan is $500? Well, now you take the same $360 subsidy and apply it to the cost of the $500 gold plan. Now you're paying $140 for your health insurance. As your income goes up, so does your share of the cost for the monthly premium. So if your taxable income rises to the very top of the eligibility range, 400% of the federal poverty level, you're making a taxable income of about $3,960 per month in 2016. At that income level, you'll spend no more than 9.6% of your monthly income, about $376 per month on that same plan, the second least expensive silver plan. So let's run it again. The second least expensive silver plan costs $400 a month. At your income, you can spend no more than $376 per month on that plan. That means your subsidy is worth $24 per month. So if you wanted to buy a cheaper bronze plan, that costs $300 a month. So you would use your $24 subsidy to lower the cost of that bronze plan to $276. And remember, if you're confused or have any questions, you can always give us a call.
Now that we've seen how the Obamacare subsidies work, let's take a look at a new study done by eHealth that shows that insurance prices are going down for 2019 for people who buy their health insurance under the Affordable Care Act.
Impact of Affordable Care Act quality. Managed care initiates have almost become mandatory, hence influencing cost and insurance. Initiatives are intended to have a mixed effect of access and act as a source of primary care, in addition to lowering the number of people using inpatient and emergency services. The impacted on quality care, since it has led to a completely new definition of professionalism where patient satisfaction is measured to ensure professionals are kept on check. Exchanges are online markets where individuals or businesses can learn about healthcare coverage options. Compare and contrast those options and choose a plan if they want to enroll in the insurance coverage. Some states have partnered with other states to create access to these websites, whereas others have joined with the federal government in the implementation of the exchange, while some have opted out of the plan. The state and national policymakers are facing challenges in the implementation of the ACA. According to Kashi, over one half of the states and some private companies filed a lawsuit challenging the constitutionality of the act. A large percentage of Americans were also in favor of repealing the law, and most people are unsure up to date. Gruber states that this has led to the implementation of policies that force Americans to obtain coverage. Failure to do so attracts a penalty.
In conclusion, the Affordable Care Act has had a profound impact on the U.S. healthcare system in terms of access, cost, and quality. Medicaid has given 31 million additional citizens who were previously uninsured access to health care. $200 billion was allocated from the federal government for the expansion of the Affordable Care Act programs over a 10-year period. The Affordable Care Act is an effective law because it has enabled millions of U.S. citizens who were previously uninsured have access to health coverage. Americans with pre-existing health conditions do not need to worry anymore about being denied health coverage or paying higher premiums. This law has also saved Americans billions of dollars on prescription drugs and cut health expenditures. References: